everyone, welcome back to Florence Health Forum. Hope your week was a good one. This topic of today will be on heart attack. A disclaimer, I'm not a doctor, so I'm saying this for people that are writing me in private. Auntie, what medicine should I take for so sickness? What should I do with this medicine? I'm not a medical doctor, so I cannot tell you how or when to take medicines. If you remember, I always tell you, go to your doctor. Okay, I can give you advice on what to do, where to go to, but I cannot give you prescription on what to take. Okay, so I want this to be clear to everyone before I start this important topic on heart attack and what to do if you are having heart attack or someone close to you is having an heart attack, or when to call an ambulance, how to call an ambulance, because this is very important for those of us that are living in a foreign land and in a non-English speaking country, in specifically those of us that are living in Italy. How do we know that somebody is having an heart attack? Sometimes you may not know. Sometimes it may be just mild symptom. Mild symptom, I mean that someone will just feel pain, it may stop. Okay, not all heart attack just crush somebody and fall down and die. So what should we do if somebody just fall all of a sudden and he is not responding, he is not breathing, the heart is not beating? What should you do? The first thing is to call the ambulance. Call the ambulance. Before you start calling brother, sister, uncle, auntie, call the ambulance. Then ask for help. For those of us that are living in Italy, if you call ambulance, majority, they speak in Italian. Okay, you may be lucky and you find someone speaking in English. What the operator at the other side of the phone, what does he ask you? He asks you some questions. But so many people, sometimes they say, I call ambulance because they ask me some stupid questions, questions that are not related to what happened. No question at that moment where that ambulance person, they ask you, will not be important. Okay? First of all, first thing you need to know, if you dey call ambulance, you need to know the house where you for the call, the address of the house where you for the call. Number two, wetin happen? Is the person breathing? Is the person heart beating? He fall for ground all of a sudden? These na small information where the doctor wey dey the other side, he go need to know. Other necessary information, your phone number, person wey they call, wetin be your name, the name of the street as I don first talk, the commune, I mean the county where you for the call, and the name of the street. How many people they involved in wetin dey happen? Now I'm talking about heart attack, but if it be say not be heart attack, we dey talk about accident and other things, or maybe house they burn or things like that. You need to give specific information. Now those specific information, now they go to know how many ambulance where they go send come. Because if now one person, they go know the ambulance where they go send. If now person where they critical condition, in the sense that they breathe, they talk, he heart not the beat, they go know the kind ambulance where they go send come, because all ambulance not be the same. They see ambulance A, they see ambulance B. So now that one they go take know the kind one, whether they go put doctor for the ambulance, I been a only nurse. Now they go put now different question where they go ask this person. Now they go take know the kind person where go take the ambulance, or the kind ambulance where they go send. This second part where I want to talk, so it is very important. It is fundamental. If I say fundamental, I mean it is important. Everybody needs to know how to do CPR. Not be only doctor work, not be only ambulance work. CPR, now that's a technique where we say they go depress person chest, where person get heart attack. Not only person get heart attack, now they depress the chest to. Don't say person just faint, they breathe, you go begin to press the chest. Now person will get heart attack. e heart don't stop, e no dey work again. If heart stop, person no dey breathe again, e go dey unconscious. All these things you need to know first, say na heart attack na you get. That means you don put ear for the person nose, breeze no dey come out, you don take e pulse, you don take everything, check e body, e no be like person wey dey alive. That one na heart attack. Why I dey talk this one? Because they dey see small courses wey they dey do. The course no even reach €100 for here, for Italy, I mean for the Campania region. You know, if you too there, €100. But this course na life-saving course. If you save your husband, if you save your wife, if you save your pikin, they go teach person in case of heart attack wetin e go do to take bring the person back to life. Why they talk this one? Because sometimes if it be say you call ambulance when this kind of thing happen, before ambulance go come, sometimes we dey complain 30 minutes ambulance never come. Sometimes na human being na the ambulance, not be magic, not be alien. Sometimes they go meet traffic for road, sometimes road go block. Before they go reach where you dey, they're supposed to take normally 10 minutes, but before they go reach, sometimes they will reach, because ambulance they walk territory by territory. Sometimes you're not supposed to even reach 10 minutes before they come. But due to a technical problem, they feel reach there 30 minutes. So in this case, now our assignment, we were there with that person, we be say if they feel bad. Now our assignment, may we take help that person. But if you know go feel help and how you go do, now just today there, they wait, make ambulance come. So now they tell us we need to take all these CPR courses, where we say now life-saving courses. Because if you say when you call ambulance, he go hold you for phone, he go they tell you say, he go ask you question, he go even ask you say whether you sabi do CPR. If you sabi do CPR, he will tell you say me you start to do CPR before they come. So now you go keep that person alive. Now you go keep the heart they pump before that ambulance go reach there. This one they fundamental. And also another thing I want to tell us, if we see ambulance for road, that they blow siren, that they speed they come, maybe they come up for road. If you see ambulance they come from your front, sometimes you go just see ambulance, you go occupy the whole road. You go take both left side, you go take both right side. Not be because the ambulance chop belleful, because they go save life. Now when we go block those ambulance for road, now they know they quick they reach where they go. So if now your front the ambulance for the combo, give way, space out, make it for pass. If now your back is still for the combo, park, may you let them pass, because that ambulance now mission, life-saving mission, now they mostly they day. So as I was saying, what we just need to do now, take simple instruction. And meanwhile, when we call ambulance, we no need to cut the line. We need to make sure say now them cut the line, because if you be say they still they talk to you, you just cut the line. You need to make sure say ambulance now cut line for the other side. Why them don't? It means say they don't get the whole information. It is clear they cut the line. If you cut the line for you, if you be say they never finish to the talk for them. And meanwhile, if you don't call ambulance for the same accident, for the same situation, make another person not carry the call ambulance again. It just they cause traffic for that ambulance line. So make we dey calm. This one are the most difficult thing, because if they difficult, say somebody faint, you know they breathe, you know they talk, we go dey calm. Now only that calmness when we dey talk to ambulance person, now I go make am understand our situation. If we not dey calm, you dey shout for phone, you dey shout, we will be mothers. If it quick or say we go just dey shout, but that shout at that moment, it not go help us, because the person wey dey the other side, you not go understand us. So make God not let us see bad thing, but all of us need to take these courses. Nowadays, doctors, nurses, even teachers wey dey our children's school, them they take CPR courses, they take all these life-saving courses in case of anything. So we need to take them. You feel just dey crowd, you feel just dey anywhere, you feel just dey inside bus. You need to save that life if you can. That is it. So, brethren, enough. A word is enough for the wise. This one, they very important. May God bless us. Have a nice day.